Hello, hello, everybody, and welcome to our first ever 50 and 50 um, challenge Zoom. We're excited that you're here and just looking forward to seeing what kind of growth we can generate through this. But for those of you who don't know me, my name is Harlequin Murray, and I'm going to be your host this evening and through this journey. Looking forward to it. It's my first time running a challenge like this for a large group, so looking forward to seeing how that goes. But for those of you that don't know me, I have been in network marketing for way too many years that I want to admit, but I have a very strong background in banking and insurance. Not health insurance, but I've been in the property and casualty end of things in the past. So I know a little bit, I know enough to make myself dangerous, but if you don't have experience, don't worry about it. We're going to help you all the way. But I'm going to go ahead, and we've still got a bunch of people joining, so I was kind of holding off a little bit to get started with our presentation. But anyways, tonight I'm looking forward to having everybody participate and get involved, and let's make this fun and get it going. But I'm going to see if I can go ahead and share my screen here. Let's see if I can do this. Just one second. I haven't ever gone and shared a oh, this is gonna maybe make this kind of short. Just one second, people. Show all windows. There we go. All right. Can everybody see my screen? Anybody who's on camera? Janet, thank you. I appreciate that. And we'll get that started in the slide share. There we go. And I just happened to realize something. Just one second, folks. Ellen had something that she had to handle real quickly, and she is not able to go and let people in. So okay, there we go. We've got more people coming in the waiting room, and Ellen's not able to help with that right now. So just one second and bear with me, folks, as I try and get this out of. Okay, we'll just have to. Can you? I don't know if you guys can see who the participants are that are coming in here. So anyways, first off, welcome everybody. If this is your first Zoom with us, I know I've got a couple of brand new agents who are joining us tonight. So I'm super excited about that. But anyways, tonight we're going to be talking about our 50 in 50 challenge. We're trying to get our businesses set up for success by creating a residual income base with our healthcare plan, and also to help your team members to be able to do that as well. You know, that's what we're focusing on tonight. I'm not going to focus on the ins and outs of our healthcare plan. We've got some training for that. We're just going to go over how we can maximize this for ourselves. But anyways, part of the reason why we're doing this, well, first off, thank you for joining us. Sorry, I forgot the order of my slides. But if you haven't done so yet, if you can join our Facebook group, and if you go to Facebook and just do a search, go to search for @DAC 50 in 50. And that will take you to that group, and that's where we're going to be announcing where the when we're having the Zooms and everything. And please invite your team to join us. And you'll see why I'm talking about that in just a moment. But the more the merrier. Yeah, the more success we have, the more it's going to spread out to the rest of the company. And please do us all a favor, interact tonight. I'm going to ask questions and go ahead and answer them in the chat, and turn on your video if you are able to do so. It's always a whole lot easier whenever I can see the reaction of people on the screen, and also that way we get to know each other better. But next slide here. Okay, this is part of the reason why we wanted to go and start off this program. If you get 50 healthcare plans, that's going to generate 2,000 personal residual revenue points, and it will equal $1,000 in a monthly residual income. Okay, but with that, you will go and you will max out on your personal commission. So anytime you have personal volume that has residual revenue, you're going to get paid 50% of what those points are. On your enroller overrides, you're going to max out and get a 50% override on anybody that you personally sponsor. And then there's something also called the 7-level bump up that you get once you hit 1,000 points. You know, at 1,000 points, you get any of your residual revenue. Like today was monthly bonus day. Did you get a residual revenue today? I hope so for your sake. But you will end up getting a 25% increase. If you earned $100, you would get 125 instead. If you got $1,000, you'd get 1,250. So it can be a substantial boost to your income. And you only have a year from the time that you signed up, or if you were signed up prior to May 1st of last year, then, or of this year, I mean, you have until May 1st of next year in order to qualify for that. But if you get the 2,000 points, you max out on that at 25%. So some wonderful reasons to go ahead and try and hit that level for yourself. However, if you help 5 of your team members get the 50 plans each and help them earn the $1,000 and get all those other things, as long as you don't have more than 2 people in any one team of yours, you become an area director at that point, because you have 10,000 points, which is the requirement for area director. And whenever you become an area director, you earn a $400 monthly car bonus. You get an extra 30% override on your entire team's residual income, which that can be a substantial number, people, especially when you've got 10,000 points. And once you hit area director, there's something called a coded bonus, which I know that's a little bit over some people's heads right now. So just know that once you hit area director, anybody that you sponsor after that, they're in your area director code, and you get a 20% override on that team forever. So anybody on that team, you will always get an extra 20% override on their residual income for life. So that can also be some substantial money. Okay, so moving on, if it will move on. Okay, there we go. Now, this is where we're going to get interactive for a minute. And is there anybody who has had some suggestions or some objections that you would like to get suggestions on how to overcome them? If you do, if you can raise your hand, and I will call on you. Has anybody had any objections, or questions that you haven't been able to answer. I know there's at least one or two people on here who have made comments about it. And I'm not, okay. Norma, go ahead and unmute yourself. And I'm going to take this off of screen share for just a second so we can see you.
Oh, hello. Hello, Harlequin. Hi.
Okay.
Sorry, I'm
Now
not
we're
available.
not going to get to see you.
Hi, Bomber. I know. I'm so sorry. Hello, everyone.
Okay.
Quickly, I did speak with somebody yesterday, and she actually happens to work in the medical field. So this is a really good learning opportunity for me, and she's actually willing to help. She's a good friend of mine. One question that came up was, how does this compare to Aflac, being that it's supplemental? Do we have an answer for that? Didn't know how to answer that.
Well, Aflac, with them, they don't offer the same type of coverages. We do have the critical illness and the accident add-on coverages that would compare to Aflac, but outside of that, Aflac, they strictly do supplemental, and this is not a supplemental type plan.
Okay. Yeah. Because I know that they offer the comprehensive major, but they also have a supplemental component, which is really nice because it's like you can get everything under one umbrella, or it's kind of like a la carte if you needed the supplemental. Okay. And then she did ask some other questions that I think would be better suited for a phone call if we just do the phone call with the advisor. But one of the things that came up was, gosh, hold on. I'm so sorry. I had it on my notes and I don't know what I did with it. I apologize. Maybe if we could just come back to
Okay,
say,
yeah.
okay,
Yeah,
thank you.
Just to let you know, I have approached a couple of different Aflac agents about becoming DAC agents and adding our healthcare plan to what they offer.
Oh, wow, that's awesome. I didn't think about that. Are
Yeah,
they like not
absolutely.
so because I have no idea, like if they're captive, then obviously they wouldn't be able to do that, but sounds like they can, right?
Yeah, Aflac agents are not captive because they don't have now they do have, I was told by one person that they do have to get approval from whoever their overall broker is. And yeah, so, and actually I've got somebody who I know happens to be an agent, an insurance agent. So Bob Amato, did you have a comment on that?
Yeah, I used to be an Aflac agent. You need to be licensed to be a Aflac agent. Their products are mostly for things that happen accidentally, and they've expanded their book of business considerably since I've been with them. But you need a license. Our product, our health share product, does not need a license, so that's the major thing. The other thing I found, and don't shoot me for telling you this, their products are a little bit overpriced if you really want to know. So they have to pay for all those ads and, all the blimps and putting their names on stadiums. Good products. They got a very aggressive sales force. It's a totally different business model than DAC. DAC, in almost every case, you don't need a license. So that's the major advantage to what we do. And DAC, Aflac, they want you to recruit other agents. They have quotas. They don't say that they do, but they do. And if you don't hit the quotas, then they basically don't want to know who you are. So I tried it for a couple of years. We used to call ourselves ankle biters, which meant that we would go and try to get as much business as we could. But honestly, right now I'm in open enrollment for Medicare, Medicaid, and ACA. So if I was going to put my energy between Aflac and this, I would definitely put my energy into this, especially with a promotion that we're having 50-50. And so to answer your question, no license, no E&O insurance. I think better products here, frankly, and less aggression. So, I mean, you can make a lot of money in Aflac, but it may take you 3 or 4 years to get it off the ground, to make a significant income. That's not the case here. So,
That's great input. Thank you so much. Sorry, I remember the question, Harlequin. And the question yesterday was, I know that Clearwater essentially is going to check all of the different options that are available and help compare those options against their own to see which is the best solution for the individual. And they said, what is the platform that they go on? And when I went on ClearShare, I saw a Clearwater, I saw they go on healthcare.gov, but she, being in the medical field, has a deeper understanding and had more questions. Well, how is it that they're going in there and making those comparisons? I didn't know how to answer that.
Yeah, well, they have their own product in addition to what's on healthcare.gov. So I know that they are able to go and check multiple places. I don't know the ins and outs specifically on how they do the comparison for the healthcare.gov. I don't know what platform they're using for that. Ellen, do you have any input on that?
I do. Thanks. Good question there, Norma. And
Thanks.
A broad answer on the question about what makes us different than an Aflac. We're a comprehensive healthcare solution where we offer that day-to-day care with primary doctors. We do the specialist visits. We do hospitalization. Every piece of healthcare need is covered with our ClearShare because it's paired with the advanced plan where you've got the copays and on everything that you do outside of going to the emergency room in the hospital. So we're a full service medical plan. So that would be my comment back to someone on Aflac and asking that question. You're going to get people asking questions about, well, what makes this different from this plan or that plan? I mentioned the other night that in Georgia, there's a company called HipNation, and I've run across that a couple of times with small businesses because it's cost effective for them versus traditional insurance, right? So I took it upon myself to actually schedule a call, and I did a 30-minute consultation with a HipNation consultant yesterday. So I went through the whole process that they would go through with the client so that I got a clear understanding of how their service works and the difference in benefits that we offer that they don't offer. So you can take a deeper dive on some of these if you keep running into the same ones over and over again, but we're full solution. On the question of how do they do that research, Harlequin is exactly right. They have a proprietary platform and they also have a broker access to healthcare.gov. So what they see, according to my conversation with Jake, is they see a different platform on healthcare.gov than you and I would if we're going in and searching for individual plans, because they actually are licensed brokers. So they've got the full array of all the big plans that cover in a particular state based on where someone lives, but their proprietary major medical plan is something that they created in-house and it's not available to other brokers to market. So we really have a unique blend of products that are in-house with us. Another thing that sets us apart is everything is in-house as far as customer support, paying the bills, everything is under Clearwater. It's not outsourced anywhere. So customers are going to have a better experience with us. One of the clients that I just spoke with, one of their pain points was, or a prospect, they haven't become a client yet, but I gave this example the other day, saving them almost $1,000 a month on their premiums. And one of her pain points was it's miserable trying to deal with their existing healthcare provider. And it's one of the big four. I'm not going to name them, but she said, it's horrible. She said, if we need anything, we call, we wait on hold, we don't get an answer, we're just bounced around. She said, it's horrible trying to deal with the benefits department of our current provider. And you won't find that with our Clearwater plans at all. So hopefully that's a little better explanation there, Norma, as I elaborated.
Yes, thank you both. Appreciate it.
Can I piggyback on what Ellen said? I'm not gonna try to take the meeting over, but I have to say this. I'm 66. I'm on Medicare. This is my third year. I just enrolled in a third different company. Because the first one, I'm not gonna mention the name, Humana. It would take me 45 minutes on hold to get an answer. Then this year it's been Cigna and they just a little bit better. And now I'm going to Aetna. So just to reiterate what Ellen said, we have a different business model here with Clearwater, and I think our people that we sign up will be much more happy. And especially when they see what they're gonna have to pay every month, they're gonna be extremely happy. So I'm very excited about it. And just listen to what Ellen and Harlequin tell you, and just go out there and meet people, shake hands, kiss babies, and you're gonna do great. That's the way I feel. I'm gonna do great. So
Good comments, Bob. Thank you.
Okay, so iPhone, go ahead and unmute yourself. Okay, you're unmuted on my side, but I can't hear you. I don't know who.
Make sure you have the correct microphone selected under the mute microphone, bottom left of your screen. There's a little up arrow and it gives you an option to select the microphone in case you have multiple mics connected to your device there. But I think you're on your phone, so I don't know how to operate an iPhone.
Yeah,
Zoom.
it's the same way. Can you see it? And I don't know what your name is. Wearing a black shirt.
Ron LeBring.
Oh, okay. Hey, Ron.
Oh, I just wanted to say we can't call it a medical plan. It's a alternative medical plan. If we call it a medical plan, that could cause a little problem down the road. The
That's because you're in
DOJ.
California.
Well,
I'm just messing with you, Ron.
I'm in 14 states, and in any state, it's a medical alternative to the traditional medical plan. It's a health sharing plan, but it's alternative to the medical plan you have. That's how you would handle it. It just, if you call it a medical plan, the Department of Insurance finds out you're going to be at risk, and that's all. I just wanted to share that and make sure you don't call it a medical insurance, because it's not. It's an alternative to medical insurance. It's a health sharing plan.
Absolutely, but yeah, good point. On that though, when we're talking about it, if we use the terminology health care and medical benefits, it is medical benefits, but because we're moving them over to Clearwater Benefits Plan, they do have insurance and they are licensed insurance agents. So we want to follow what Ron is saying and not muddy the water with wrong terminology on our side, talking to a client and getting them over to the benefits team. So thank you for that input.
can I say something? It's health care. It's not insurance. So you could say health care, but you cannot say it's insurance. So
you can say, what are you doing? What are you guys doing for health care or health insurance? Asking them if they have it, and just say, hey, we have a program or a platform where you can save up to 60% if you're open to getting a quote. We're not claiming ours as insurance, even though we're asking them what they're doing for health insurance. But I use health care, so I never get that mixed up or confused.
You'll never get in trouble saying health care.
Right.
Right. Thank you.
Okay.
You're welcome.
Okay, so we're going to go ahead and move on with our presentation. Let's see here. Got to remember how I opened this up last time.
While you're doing that, Harlequin, are we going to have people doing some reach outs and so on, or
Yes,
sharing
we
some
are.
testimonials here before we wrap up tonight? Just kind of give
Yes.
people something to think about.
Yep.
Awesome.
Okay, so we're going to share some of our successes. So does anybody want to share a success that they've had recently? I know
And it doesn't have to be a
Ellen
sign up.
shared a bunch of them.
Yeah, it doesn't have to be a sign up that you share. It could be a conversation. It could be somebody wanting a quote. It could be that you've taken somebody through the quote process. We just want to hear some activity. Anybody want to share?
Well, I'll share. I was actually talking to some people last night at a networking event, and I spoke to a couple of different, well, I spoke to several different people. There were like 100 people at this event. And, one girl was saying she's had health coverage or health insurance for a couple of years. She has no idea how much she's paying. She's been with the same company. And I pointed out that a lot of times people, you know, people change plans on a regular basis because their insurance plan goes up every month or every year. And she was super excited. I spoke to her this evening, and we're going to have a call next week. And I actually spoke to somebody else, and she surprised me and signed up as a new agent, and she's actually on the call today. So welcome to Heather. We're excited that you joined us. But we do have another iPhone that has their hand raised, so we'd love to hear from you.
Good evening, all. I'm new to this platform, that being DAC, and I am Barbara from Maryland. I have been in healthcare, and the example that was given a couple of days ago about contacting and interacting, I actually met someone via telephone out of country. And this particular person informed me out of the blue that they were going to be in our state and they were going to be involved with truckers. So, mind you, when this was stated, I thought, the universe is telling me something here. So, after hearing our presentation, I then approached this particular person and asked them how long they were going to be working with the truckers and would they mind, because we've spoken before, would they mind gathering information for me from the truckers? And they stated they had no problem with that. They are gathering data for me. I checked in with them today and they are setting up, they have set up. So I'm excited, thinking that I should have quite a number of individuals to contact to go through the process. Now, mind you, this person is out of country, but the truckers are all in the US. So I am just excited. I've shared that with the person that brought me into DAC, and she thought it was a success already, the mere fact that I had made that connection. And so I am looking forward to it. So I'm hoping that's going to be the 50-50.
Awesome. Well, Barbara, whose team are you on?
I am on Ellen's team.
Awesome. Well, glad you joined us this evening.
Thank
and thank
you.
for sharing that. Truckers are definitely a good niche market because a lot of the independent truckers, they have to go to the healthcare marketplace and they don't qualify for the subsidies because of their revenue.
Correct. May I add one other that I was able to contact also? And that is independent tax preparers. And I received a very good reception today from two of those individuals.
Awesome.
Excellent.
Thank you.
Yeah. Well, thank you for sharing.
You're very welcome.
Good stuff.
Thank you.
Okay. And go ahead, Norma. You've got
I
This
just
is
wanted to
next.
congratulate whoever spoke right now. That's really energizing. And I'm just trying to brainstorm, and I had to cut out of the meeting. I apologize, Ellen, earlier this week when we had the Monday night meeting. And I just wanted to see if we were able to come up with a little blurb on how to approach people when we are doing the initial contact, whether it's for an individual or when we are approaching a business.
It looks like Ellen had to step away for a second.
Oh, okay, no
On our
problem. I had
screen.
muted myself, but so essentially what it was is I had reached out to Ellen with a marketing email that I had prepared, and I had asked for input on that, and then I also had asked Ellen, what could we ask business owners, or how could we approach business owners that have more than 100 employees? What would be the best way to open up that conversation? And I think eventually I would like to have somebody from leadership join me on that call, but for the initial, I feel more comfortable with going off of a script that I can adjust myself, tailor to my style. So that's what I was looking for.
Okay. Well, Ellen has joined us again. So
So
I was listening the whole time. I just took my
okay,
camera.
perfect.
Yeah, I mean, it's like I said on our phone call, Norma, I can tell you 50 different opening lines. They're all going to be very similar, but nothing exact. It really depends on who I'm talking to at the time. But the basic things that you need to know are the bullet points that are covered on our website. And I know I've covered this with you, but for everybody that's listening, one of the flyers in the Agent Resource Center has valuable information on it. And I'm going to go pull that up real quick. It's the flyer that has the little circles in purple at the bottom, where it says the average savings for each individual is $8,000 a year. Average savings for someone in a group plan is $4,000 a year. 65% of bankruptcies are caused by medical debt, and 90% of those people that filed bankruptcy had insurance. Those numbers are something that you can know the numbers. You don't always want to spit those off to people, but as you're having a healthcare conversation with people, just getting them to think about what's going on. But my opening line, whether I'm talking to a business owner or an individual, is always the same. And that is, what are you guys doing for healthcare? I never make cold calls. I always go through my warm market, or someone like Barbara was sharing that she's got someone that's helping bring leads to her. That's a warm conversation. If you have someone that's asking for more information and they're reaching out or have asked to be contacted, that's a warm conversation. I only do those. I really don't do cold calling at all. If I'm calling someone that I don't know, I'm calling them because I had a referral or I've worked with someone inside that organization, and I always have that name to drop. For instance, one of my rental properties, my tenant is working for a large company, and I asked my tenant, I said, hey, what are you guys doing for healthcare? Same old question, right? And she started telling me what her company does. And she said, I think we're getting ready to do our annual enrollment. And she wasn't sure about that process, but she put it out there. And I said, oh, that'd be great. I said, is there any way you could put me in touch with the person that handles your healthcare and does that for your company? And she said, sure. And before I got home, she had texted me the name, email address of the person and the company name so that I could email her some information, which my email was just the bullet points in the email like I sent out today to you guys. But she also let that person with the company said, hey, my landlord, Ellen Wynn, I gave her your information. Her company does healthcare and health insurance, and however she put it. And I gave her your information. So she's probably going to be reaching out. So I had an intro through a warm contact inside of a company. And that's all I ever do. And if you guys will do that as a whole, you'll never be cold calling anybody. So, and Norma, I know you've already got those contacts in the companies that you have in mind. So it's not going to be a total cold call to you either. But you want to get to someone that's a decision maker that is concerned about the bottom line of the company, because that's what our numbers are going to do, is really make an impact on the bottom line of the company. It's going to make an impact financially, and it's also going to help make an impact by keeping employees happy and keeping them coming to work. Do you know that having access to virtual healthcare keeps people from having to miss a day of work to go to the doctor, because they can do a doctor's visit from home after hours and get that prescription called in for a sinus infection or whatever's going on. So it keeps them coming to work and not missing work with the employer, which helps productivity go up and keeps that employee from losing time and having to take personal days off or sick days for something that they could get handled on televisit. So we've just got a tremendous platform, and employers are going to love it when they see it. You guys may have heard the testimonial from Jake the other day, where they did a quote for a company that had about 500 employees. The company was only contributing to the employee share of the cost of the plans. And because we were able to save them so much money with Clearwater platform, that company is now offering benefits and helping cover the expense for the entire family and not just the employee only. So I'm going to go off camera again real quick, Harlequin.
Okay. And we're going to go ahead and continue on with our presentation. So let's see here. Okay, we got some other people coming in. Okay, so next, this is something that I had put in the Facebook group, and has anybody gone and looked this up to find out how many contacts you have in these different things? Your phone, how many Facebook friends do you have or followers? LinkedIn, Instagram, TikTok, any social media that you use. How many business cards have you collected? How many contacts do you have in your email? And I was looking at mine, and one of my comments to people who give me a virtual card, one of the challenges is I have almost 2,000 contacts in my phone, and they get lost in there. So keep that in mind. And I've got a couple thousand on Facebook. I've got 1,500 in LinkedIn, and I want to actually, I'm going to stop this share, and I'm going to share a different one just to show you guys. Let's see. I had it pulled up so that I could do this. Oh, I know what it is. We'll have to close that out. Okay, on LinkedIn, something that is very helpful, if you go to My Network, go to your connections, and then go to search with filters.
Hey, hang on a minute, Harlequin. Guys, if y'all don't have pen and paper, let's pause a minute here and give you a minute to write this down. Get something to write this down. She's just going through some golden nuggets for you, okay? So, Harlequin,
I'll go back.
Yep, let's start back at the beginning, because I know there are people watching right now that are just watching and aren't taking notes, and this is a noteworthy moment for sure.
Okay.
I've got my pen and paper out.
Okay, I got my pen and paper in front of me too. But yeah, with LinkedIn, one of the things that is really handy is if you go to My Network, up here on the top, and then go to your connections and look at that. And the next thing is search with filters. And you'll see here you have people, and then it says first. And you also can do a search for people with a current company. If you have a company that you're wanting to target, locations, there's all different types of filters that you can use. But this one I'm looking at here on the first level. Okay, and see it says about 1,400 results. If I go and uncheck that and check my second level, so those are the people that everyone that I am contacts with, this is the list of all the people that they know. So the results on that for me is 1,090,000 people. Do you think I can find some people in amongst that? And even if you only have 100 people, you're still going to end up with at least 1,000 on your contact list. And what's nice about this is you can go and either reach out directly to the person, and I'm gonna go ahead and look at this person, and it will tell you, okay, this particular person, he and I share these people. So David Karen, David Young, and 31 other people. So this is somebody that I've probably actually met him, but haven't connected with them on here. But the thing is, you can then go and send that person directly a message and say, hey, send them a connection request and say, hey, I see that we've got, 33 friends in, mutual connections in common. And I would love to find out, how do you know some of these people? And I would like to connect with you. Or you can go and, say it's the president of a company and you're like, I don't feel comfortable going directly to somebody on that level. You can go and ask one of your mutual connections and say, hey, how do you know this person? And would you mind introducing me to them? So that's a great way to do that. But then just for giggles, my third level is 966 million. So I don't think I will ever in my lifetime run out of contacts. But I just wanted to show that to you for those people who are in LinkedIn. LinkedIn is much more of a business type networking platform as opposed to Facebook. But I just wanted to point that out. So if you guys can go and take a look at those different things and see how many contacts do you really have. And then our next thing. Okay, this is going to be our assignment for the next few days. First thing is, if you haven't done so already, get a quote for yourself. Or, if you're over 65, maybe a friend or family member will let you do that. But see how the process works.
Hey, say you're under 65 and do it for yourself if you are.
Yeah. But just go ahead and find out how that whole process works. After you do that, reach out to your family and friends and ask them if you'll let them practice on them, and go ahead and get a quote for them. You never know, they may go and say, well, wait a minute, that would save me a whole bunch of money. I think I'd be interested in that myself. So you never know what's going to happen with that. And then the next thing is to set your personal goals for your daily and weekly activity for this promotion that we're doing, or this challenge that we're doing. And I just gave some examples of what you can do. You know, if you're doing this very, very part-time and, you know, you've got a full-time job plus a whole bunch of other things going on, reach out to anywhere from 1 to 5 people a day, you know, and that's just reaching out to them, not necessarily having the conversation, although the goal is to have at least one conversation per day with somebody about healthcare, for somebody that's very part-time. If you're doing it part-time and you've got, you know, a couple hours a week or, you know, whatever, 5 to 10 contacts per day. And then if you're full-time or if you have full-time ambitions and you want to generate enough money that you can quit your day job because you have the residual income coming in, shoot for 10 to 25 contacts a day. Or if you've got, you know, as Grant Cardone says, if you have 10x ambitions, reach out to a 50 to 100 contacts per day. And, you know, not everybody's going to respond back to you, but at least that's the activity that you can control, is how many people you reach out to and try and start a conversation. And you don't have to necessarily talk about healthcare to begin with, but just start that conversation. And then the next part of this is share your numbers on we're going to do a daily post in the Facebook group, and I'll just go and start it off, you know, at like midnight every night or whatever, and just go and put down, hey, my goal was this, and I was able to I was able to reach out to however many, and then list how many responses you got back. And if you're able to get, if you've signed up somebody. But anyways, and okay, and Norma, you're asking where do we go again for the Facebook group? I'll share that in just a moment. But what we're going to do now is we're going to reach out and, you know, grab your phone and start at the end of the alphabet, because people usually never get to the end. You know, they start at the beginning and so start with your phone contacts and just go and send a quick text message to them. You know, I did this the other day, and it was kind of funny because there were some people that I had not spoken to, and I'm like, in quite a while. And so I reached out to them, and some of them replied back, and I had some wonderful conversations with them. There was one person that, Zach Fox is not a common name. And I had a Zach Fox saved in my phone, but I thought it was another guy who owned a hot dog store. And anyways, it was the wrong one. So I started this conversation and he's like, Fox dogs, what's that? But it ended up he was somebody who had helped me move several years ago. But just go and reach out to them. And if it's somebody you haven't spoken to in a long time, you can go and say, hey, I'm looking through my phone book, and let's see here. Here's one that I had reached out to. And, I put, this is Harlequin. I'm going through my phone and touching base with people I haven't spoken to for a while. I hope you're doing fabulous. I would love to catch up with you when you have a moment. It can be something as simple as that. But, or if it's somebody that you know and you've spoken to quite a bit, it's like, hey, just wanted to touch base with you. Can you give me a call whenever you have a minute? And I just wanted to talk to you about something. But Ellen, did you have any other suggestions on what someone can say?
Sure, I do. So if it's somebody that you haven't talked to in forever, you could say, hey, Ellen Wynn here. haven't touched base with you in a while, just checking to see if this is still an active phone number for you. That's a good one to get someone to respond back to you. And then they may say, well, yeah, but who are you? And then you know it's not the same person, but that's a conversation starter. Or if you're just trying to go through a bunch of numbers and you're not wanting to have conversations like Harlequin is suggesting, to have them reach out and y'all talk, and it's somebody that you haven't talked to in a long time, you may send them a message. If you know it's an active number, right? Maybe somebody that it's been 6 months, a year, maybe 2 years since you've talked to them, say, hey, I know we haven't talked in a long time, so this is going to be a crazy question, but what are you guys doing for healthcare? Right? You can put a disclaimer in there in the beginning if you just want to be able to blast through some text messages and hit a lot of people and see who responds. Now, don't do more than what you can respond to and get an active conversation going. But if you do get someone in process, I'm a big proponent of not just sending out my link. I really, really, really suggest that you get them on the phone, talk to them and say, hey, I can send you some information, send those bullet points in an email and tell them to respond back if they're interested in learning more. And then when they say yes, and you respond back after they've gotten the bullet points of how our program can help them, say, well, I'd love to get you a quote. You got a few minutes? Let's go walk through that now. Get them on your computer, while they're on the phone, ask them the questions and do just like we did on Monday night. That would be my recommendation. One other thing on this, Harlequin, if I can throw in, as you're talking about the assignment and what to do, David mentioned this. He's been talking to us about doing live videos. Guys, the live videos that I've posted on Facebook, my personal videos, have been tremendous traffic generators. That outside of a picture of my house, and that just keeps bringing in pictures and stuff, right? Our comments and stuff. But the live videos are what is attracting attention about healthcare. So go live on your Facebook page. If you don't know how to do that, then set up a group. Go to groups, set up a group, and in your own little private group where you're the moderator, you're the only one that can see what goes on in there, practice going live in a private group page.
Yep.
I've done that many times. When I first started learning how to use live, I did that up. Nobody will see you because it's private to you. When you set it up as private. Nobody can find you. Then you can practice your skill. One other tip I want to give on doing lives and something that you can use. I'm going to share my screen real quick. When you go to, once you filled out the form on the David Allen Capital page, it sends you over to the co-branded clear water page with the DAC healthcare, like you see at the top of the screen here. With that, look, guys, at the bottom of every page you click on, there are tremendous testimonials. Y'all have heard my testimonials. You've heard different stories about how our plans have helped people. Here's what I suggest for you to be able to do a live video on. Take one of these testimonials down here, put it in your own words. You don't have to name the company, right? But I love the one that they talk about with Terry. Let me see where he is right here. I spent 12 weeks in ICU, this one in the middle. You could get on, if I were doing a live on that, I might say, hey guys, Ellen Wynn here, or hey friends, Ellen Wynn here. I just want to share a quick testimonial about one of our healthcare clients who spent 12 weeks in the ICU. Their bills mounted up to about $2 million. They were in the hospital a couple of months, and had they not had our healthcare program, the client says they probably would have gone bankrupt. They only had to spend $1,000 out of pocket. That was it. If this resonates with you, or you know someone that we might be able to help, hit me up. Something like that. But I'm sharing in my own words that testimonial, right? You could even do that reading off of your screen to put a testimonial into your own words and share on Facebook Lives. There are dozens of them in here, and I just think that that's a win-win for you if you try to do that. Before we go to Brian, Harlequin, tremendous job tonight. Everybody give Harlequin a hand. This is her first run at running a team Zoom on my platform by herself, other than one time I think you had to stand in. She took the initiative on this. She put everything together, and really great job. I appreciate you taking the lead. And I know everybody on here does too, but super job, and congratulations on taking the initiative, coming up with the idea, and then taking action so that everybody else can participate and benefit from what you have in place here.
Well, thank you, Ellen. I appreciate that.
Absolutely.
I'm looking forward to doing quite a few more of these. And keep an eye out on the Facebook group, because we will be adding in our next Zoom. I didn't get a chance to talk to Ellen to determine when we're going to do the next one. I do have a poll in the Facebook group requesting times when it's best for people. In the evening during the week was the top one, but afternoons during the week and weekends were also they were tied for second place. So anyways, so
Yeah.
with that, pardon?
We have 3 hands up now.
Yeah, and I've got some questions in the chat as well. But people, while we're doing this, go ahead and send out some send out your 20 messages. So that way, because some of us have gotten behind, I'm guessing, and are not on track to get our 50. So let's go ahead and do that while we are listening to the questions. So Brian, go ahead and unmute yourself. Actually, I see you're unmuted, so go ahead. What's your question?
So if I like the way Ellen said about doing a Zoom, if it's your first lives that you're doing to kind of practice in a small group. Now, is that I mean, if you're already in a group, like say you're in a contractors group or something, and it's a pretty small one, but you're a member in that, and it's marked private. So if I go into that group and do a Facebook Live within that group, is it going to be seen everywhere, or is it just going to be seen by the people in that particular group?
It will
I'm
just
not
be
familiar with how
seen.
that works.
It's just going to be seen in that private group. You have to be careful though, and make sure that it does not violate the rules for that particular group.
Right.
Some groups allow you to promote things and other groups do not. So it's going to solely depend upon that. Now, Ellen was bringing up, if you go and set up a Facebook group and you make it private, and you can make it so it's private and not visible to anybody. So that way it's a group that nobody else is going to be in there, but you can go ahead and do a live within that group just to do practice. But you can go into other groups if they allow it and do a live. If you go onto your main Facebook page, then that would be visible to all of your connections and all of your followers that you have on your Facebook page.
If you're in the group and you get it and you do it and you like what it says, can you share that at that point to your page if you like how it turned out?
It wouldn't. That's a good question. I'm not positive. I know it would not be a live at that point. It would be a recorded video.
Yeah, that's true. That's true. It wouldn't be
Yeah.
live.
Whenever you go live, everybody is notified that it's a live video. So you tend to get more people are notified that you're live. So
But if I do it in a private group like that, that's just me to practice doing it, then nobody's going to get notified, right?
that's correct. Yeah. It's just for you to it's just a practice platform so you can learn, okay, you've got to push this button to go live, and whenever you're finished, you push this button to stop it, that type of thing. So it's just for you to practice, and then you can go ahead and do it. And you know what? You're gonna make mistakes whenever you do that. And you can go back later, and the more you do, the better you get at it. And, you know, like a year from now, you can go back and look, and it's like, oh, wow, you know, I did really, really lousy when I first started this. And now look at how much I've improved. But
And if I can add something on that, Harlequin, Brian, on that, and for everybody's benefit, if you go to Facebook and you click on the groups icon at the top of your page, there on the left-hand menu, it'll pop up that says create new group. That's where you can go in and create your own new group. And under the settings, you want to set it to private. And that way you're the only person in that group. You can do whatever on that page. You can practice your live streaming in that group by going live in that group page, and nobody will see it. Another thing you might want to consider if you're not comfortable with doing lives yet is to record yourself on video, right? Either the free Zoom, you can do that on Zoom. And then once you have a recording that you like, download it to your computer, save it to your computer, and then go to your Facebook page and you can upload that pre-recorded video to your Facebook page, right? That way you are comfortable with what you have already there. But video is really the way to get people's attention on social media. So go have some fun with it.
All right. Thank you much.
okay, Janet.
One of the questions he was trying to ask is like if he ended up with one that he liked, could he share it? But you usually can't share from a private group.
Correct.
So back to the LinkedIn, I noticed on some of your lists, and I've seen it on my own as well, like some of those people, you can only follow them versus connect, or some of them say message.
Okay.
Do we know
I
why?
will show you real quick. There is a way to get around. Well, I'll
Do
try
like the first one says connect, the
Okay,
second one says just
okay.
message.
Yeah, this one is only allowing followers.
Right.
If you click on the more, then you can choose connect.
Oh, so you have to go to their profile per se.
Yeah, you go to their
Gotcha.
profile and you click on the, you know, if it's only showing follow, if you do more, most of the time it's going to say connect. Does that help?
Yes, thank you.
Okay.
And
Awesome.
the other thing is, I was talking to a girl this morning and I used so what are you doing for healthcare? And she was explaining to me that her husband is like a manager in our big grocery store and he wants to quit his job. And so she'd been looking for healthcare to switch them because they're all under him. And so when I showed her my brochure, I had these brochures printed and she noticed the Clearwater. And I said, but if you come with us, we have special pricing because we're a big group. So I was able to share that with her, and they have 3 kids. And I also told her, because I wasn't sure if like he would stay on. I said, if you want to do it now, put you and your kids on with us, and then he can switch afterwards, or however she wanted to do it. So she's like in gathering mode, but I was impressed that she noticed the Clearwater.
Okay. Well, thank you, Janet.
You're welcome.
Norma, Susanna, you have another question?
I do. Sorry, I have quite a few today. So I have a couple of points and I'll throw all my points out so they can hopefully all get addressed. So one of the questions that I had, I asked Ellen directly, so I'll let her take a look at that and see if we could get that answered. The second one was feedback to Brian and everybody else on the team. Actually, I just finished reading for the second time this book by Zig Ziglar and his son. It's called Born to Win, and I highly recommend it because he talks about the power of actually taking the time to practice. your presentations. So I'll just leave it at that. If you guys are interested, it's a very powerful book, Born to Win by Zig Ziglar. And then the other input was, I love the idea of the lives and the groups, because that's not something that I've thought of, even though I have my personal page and also a Facebook business page. I love the idea of getting on there and practicing, and also doing the practicing on videos that we can go back and see. And once we do get comfortable, we can actually just plug in things like, hey, really excited to share that, we just rolled this out. So there are a lot of features that we're still learning about, but the most, the most important points that I want to share are A, B, and C. Keep it simple, right? And then from there, I think generating the interest. So that's going to be super impactful. And I think that was the last. I had one more question. Oh, to the lady that just spoke and mentioned that because we have a big group, that our pricing is better. Is that a fact? Because that'd be a great line to use if it is true.
I don't know that that's factual.
Okay. All right. I was just curious because in some circumstances, right, if we do have like a larger group, then, there is an advantage. I mean, there's no incentive for them to go and circumvent us and work directly with Clearwater. I mean, if we're the one presenting it, we could just let them know that they get additional support in working with us. I mean, I don't know. I just want to avoid being circumvented once they know who it is that, is the platform.
I would worry less about being circumvented than I would worry about somebody else getting to them with a good healthcare plan before you do. So that would be my concern. I see your question there, Norma. Okay, so we're going to go through the workflow. If you're talking to a business owner and they want to speak to someone about a business advisor, it'd be if you're on the phone with them, or if they've responded via email, it's going to be exactly the same as what I would do if I'm talking to an individual, except I'm not going to get them a quote, right? We've got to have, if it's a business owner, we're going to need some information about their structure. If they've got at least 3 employees, then we can do direct billing and put them in a group. And that's the benefit of having a group, is they get a list bill from Clearwater, and then they're going to make their contribution, or they're going to pay that bill and pull that contribution out of the employee's paycheck. So I'm talking to somebody, they say, yeah, they want more information. I'm going to call them while I have them on the phone. I'm going to go to my DAC healthcare page, and I'm going to click on the group tab, because we've got 2 different pages there. On the home, everyone, if you haven't revisited the healthcare page, it's been updated since we first launched this product. They've added some pages and done a really nice job with it. So on the home button, you've got individual on the left and group on the right, or you have direct pages. When you click on that, it's going to take you to Health Share as the secondary page for individuals. And I think Group Health is the group plan. I may be mistaken on that link, but just look at your page and see. And when you're on that group page, just get their information on the phone, fill it out. Okay. Ask their name, their best contact number, email address. And then once you complete that, it's going to take you straight over to the page to go ahead and book a call with the benefits team. And again, you're going to fill in their information, their contact name, their email address, their phone number. And then you're going to select how many employees are in their group. And then it's going to ask, do they currently have health care? Yes or no. And then once you hit continue, it's going to take you straight over to a Calendly link for the benefits team that handles group benefits. It's going to have a Calendly link in front of you, and you just go ahead and book that call. Ask them, say, well, I even have some time slots available this afternoon or tomorrow. What works best for you? And then put the ball in their court so that they can tell you what kind of timeline they're looking at. And maybe they're super busy and they're looking at their calendar and going, hey, I have some time on next Tuesday between 10 and 11. Do you have anything then? And you can just click over on that date on the calendar, pick that time slot if it's available, and then you're going to fill out more information on the Calendly link. So I typically, when I'm asking that business owner for their phone number and their email address, especially if I don't know them and already have this, I pull out a notepad on my computer and I'm typing it in on screen, copying and pasting it into a notepad. So on the second and third time that I'm going to need to enter their email address and phone number as I'm filling it out myself, rather than waiting for them to fill it out, I'm just copying that information from the notepad and pasting it into the form itself. But I'll go ahead and confirm that all the way through to the end. And when I click submit and get a screen pop up that we're booked, then I will tell that client, I'll say, okay, I just submitted that. We're locked in for next Tuesday at 10 a.m. If you can check your email real quick, I want to make sure that you receive the Zoom link on that, or the meeting link on that. And that meeting link, if it's for less than 25 people, it'll be from Jake from Clearwater. But just ask them while you're on the phone. That way you point it out, they go ahead and pull it out. They can click yes that they'll attend, so it automatically populates on their calendar and you're seeing it through to the end. Also on that calendar link, you have the ability to add additional participants on that. So Norma, if I'm on there with a group, if I'm talking to one person in the company, I'm going to say, okay, is there someone else? Find out who that person is. If this is a office manager or an admin or a human resource person, I always want to get one of the owners or one of the C-level employees involved in the conversation. So it's not a pass back to, oh, well, let me take it to my boss. You need those decision makers on the Zoom. So it has a spot for you to add additional participants. You want to get those emails and say, is there someone else that we need to get on this Zoom with you? An owner, a CEO, depending on what level company they, it may not have a CEO or a CFO. If it's a smaller organization, then you're asking for an owner to participate, right? But get that email address so they get copied on it as well. And then add yourself. Add your email in there. There'll be a spot for some comments. If it's if they need Spanish speaking support, then put that in the comments. Or in my case, I'm doing a little summary and I'm saying, I am a physician. I own a physician practice with 2 locations. All total, we have 16 employees currently offering healthcare through Aetna. Our prices have gone up and we're interested in seeing what your pricing is. That's what the business owner told me. I put that comment in the form. So whatever you put in that form, that comment is going to go to that business owner when they get copied on the calendar link. So you always want to speak in first person in that comment in the link as if it's the client that's filling out the form. Okay. But that's it. That's as plain and simple as it gets. It really only takes, it's taken me a few minutes to explain it, but on the phone, it's a 5-minute process. And then you've got them locked in on a calendar. If they start asking you a lot of questions, just say, we're going to need a census of your employees, which is a list of employees, whether they, who's opted in for insurance. Is it the employee only, or is it employee +1 plus family? That whole census with their date of birth, we're going to need that. So you can go ahead and tell them on the phone, once you've got them locked in, say, check your calendar link there. But if you can reply back to that calendar meeting with a census of your organization, we'll go ahead and get you a quote ready by the time that our team talks to you on Tuesday. That's how it works. It's really that simple. And then you've done the hardest part, is having that initial conversation. Now it's completely over to the benefits team. Those guys are going to be handling the call. They're going to be handling questions. They're going to be handling follow-up emails back and forth with the client. I've done several of these now. I had one today that I did two different companies with same owners, and Jake did that. The lady said that she was going to be following up. We've not heard anything back. So I sent Jake an email this morning on that last communication from that lady. But I just replied to him, not replied all. And I said, hey, have you heard anything from these guys? And he said, funny you reached out. I had them on my follow-up list today. So then I let him take the lead with the client. With my communication, I let him take the lead with the client, sending them the email asking if they had further questions, or were they, moving things along. And he sent them a very professional email. I'm already copied in that sequence because I was on the Zoom meeting initially, and I'm in the middle of all the back and forth emails going on. So I'm sitting here with a bird's eye view, not having to sit back and wait until something shows up in my DAC back office, or not having to sit and wait and wonder what's going on. I'm in the middle of every bit of it that's happening out here. And every one of you have the same ability to do that. So take it and run with it. I'm reading chats now.
Okay, and actually, thank you for that, Ellen. That's phenomenal.
Yes.
And I will add, and I apologize, I was trying to type something in. I've got the Facebook group. You can just tap on the link and go directly to the Facebook group if you haven't joined it already. Please answer the questions because it helps me know what cities or what states people are in and what teams people are in. But did you mention that there's a comment section in there? So like if you have somebody who speaks Spanish, you can put that in there?
Mhm.
Okay, sorry.
I did.
Like I said,
A follow-up question to that is, can we join the call? Yes, you can join, whether it's an individual or a group. Is there a rule against reaching out to medical professionals who can present to their patients? No, I mean, it would be totally compliant as long as you're not crossing that boundary between medical plan, healthcare versus health insurance. So if you're never representing it as health insurance, you can absolutely have that conversation with a professional. Of course, that professional would want to make sure that they're part of the PHCS network so that their patients could continue seeing them and using that insurance plan, or not insurance alternative, using our health share plan with them. Does the email confirmation indicate what the business owner needs to prepare? It did, but I know they've changed the platform. So that's why I say in that census, they know what a census is, a business that is providing health insurance or health care to their employees. They know what a census is because they've been through that before, but it's exactly what I just listed. A census is a list of employees, their date of birth, and whether the employee plus one, employee married, or employee and married with a family. And the other thing would be, what is your contribution rate on that? I've got a questionnaire that I was using, but it's not necessary anymore since they changed the platform and improved it. So that's all I see in the questions there in the chat.
okay.
Anybody else?
Well, I've got one. Bob Amato was asking if about accountability partners for this 50 and 50. And I think what I'm going to do is I will put in the Facebook group, I'll put a post up there, hey, anybody who wants to have an accountability partner, go ahead and put your name in here and we'll go ahead and try and pair people up. It's usually best if you have an accountability partner that's on your team, but if you don't have anybody on your team, that's perfectly okay. But and we're also, like I had mentioned earlier, we're going to have a daily, hey, this is what my goal was, this is what I actually accomplished, and we'll do that as well. But
Awesome.
how is everybody doing? Has anybody been going? I'm going to put this on gallery view. Has anybody had any success or responses back from the text messages that you've sent out? Or has anybody accomplished their 20? You can go ahead and send me a chat message.
I have.
Okay. Yeah, I've been talking, so I wasn't doing that myself, although I have sent out messages, but
Harley, can I
anyways,
direct message question here, if I can answer this?
sure.
What would you say to a business owner that asks about employees with pre-existing conditions? My answer is, we have a comprehensive benefits platform. And if you can't remember that, just look at the main page on your DAC site and take your verbiage. Everything that I say to a client basically came from me studying our website and studying the information that is customer facing, right? So when somebody asks me a question, it's kind of comes to me naturally because I've read and gone through it so many times. But I'd say we have a comprehensive benefits platform. So we essentially have a program for just about anyone, but that would be better suited for a benefits team on a case-by-case basis. That'd be what I would tell them.
Awesome. Well, if you guys haven't done your 20, if you want, go ahead and do it now. But does anybody else have any other questions or comments or successes that they've had? Crickets. Okay.
If I can say something too, guys, I know we've gone over an hour and our intention with these is to keep it at an hour so that, you know, you guys will want to come back and back and back again. But I know this being the first one, kind of laying the groundwork and getting some basic information out there. The extended time was needed and appreciated, but in our future power hours, they will be 1 hour or less. And an opportunity for you guys to come together and share and, you know, present your challenges and more of a interaction rather than us trying to do, you know, present what we're doing every week, because we've covered that now. It's going to be posted on our YouTube channel and y'all will just have to stay caught up. So.
Awesome. Well, thank you everybody for coming out tonight. I'm super excited about this and looking forward to seeing a lot of success and people getting ranked up in the DAC compensation plan. And I'd love to see some area directors so that we can have a bunch of people making some fun money and getting those car bonuses. But anyways, without any further ado, I'm going to go ahead and say good evening. Thank you for joining us, and take a look at the Facebook group and we will post the next Zoom in there. Take care and have a great day, everybody.
Everybody, good
night.
night. God bless.